Questions 401 to 420. 401. A 4-days-old baby diagnosed with physiological jaundice. His father is distressed and wants to know why he have this condition. What should the nurse tell thee about the most prominent physiological jaundice? A. Immature hepatic function. B. Decreased milk intake. C. Rh incompatibility. D. Red blood cell enzyme defects. The answer is A. Immature hepatic function. 402. A newborn with hyperbilirubinemia was started on phototherapy. What will be the nurse's instruction regarding feeding? A. Feed glucose drinks. B. Breastfeed twice hourly. C. Bottle feed till the bilirubin level reduce. D. Breastfeed alternatively with bottle feeds. The answer is B. Breastfeed twice hourly. 403. Which action a nurse needs to include when caring for a newborn receiving phototherapy? A. Expose all surfaces. B. Prevent stimulation. C. Cover the eyes with shield. D. Change position every 4 hourly. The answer is C. Cover the eyes with shield. 404. A baby born at 35 weeks was admitted in neonatal intensive 27 hours ago. Physical examination revealed yellow discoloration, sclera and mucous membrane. The result of bilirubin level every 170 moles. The infant was diagnosed with neonatal jaundice. Physician ordered to start single phototherapy. Which of following should the nurse consider as a priority during phototherapy of this newborn? A. Ensure proper fitting of eye covering, patches. B. Monitor bilirubin levels every 48 hours. C. Feed the infant formula every 4 to 5 hours. D. Avoid removing the infant from phototherapy. The answer is A. Ensure proper fitting of eye covering, patches. 405. A nurse prepares to administer a vitamin K injection to a full term. The mother wants to know the importance of the injection. Which of the following is the best nurse response to the mother? A. Needed for blood clotting to prevent hemorrhage. B. Accelerate the growth and development of infants. C. Help and maintain healthy gut and passage of meconium. D. Protect the infant from developing severe respiratory distress. The answer is A. Needed for blood clotting to prevent hemorrhage. 406. Term baby boy is admitted to Neonatal Intensive Care Unit. Physical examination revealed flattened nose, low-set ears, upward slanting eyes, GLE palmar crease. Which of the following is the possible diagnosis of the newborn? A. Cushing syndrome. B. Down syndrome. C. Intrauterine growth retardation. D. Congenital hypothyroidism. The answer is B. Down syndrome. 407. A nurse performing nursing care plan for a neonate after a birth. Which intervention has the highest nursing priority? Neonate. A. Obtained a dextrosticks. B. Give the initial bath. C. Give the vitamin K injection. D. Cover the neonate head with a cap. The answer is D. Cover the neonate head with a cap. 408. During physical assessment of a male infant genitalia, the nurse found that one of the testes are enlarged. Which of the following could be the reason for swollen testes? A. Cordy. B. Cryptorchidism. C. Hydrocele. D. Hypospadias. The answer is hydrocele. 409. A newborn is diagnosed with hypospadias. When teaching the parents of this child, the nurse should tell them to avoid which of the following before the hypospadias repair? A. Circumcision. B. Drinking acidic juices. C. Urinary catheterization. D. Riding a bicycle. The answer is A. Circumcision. 410. When performing a newborn assessment, the nurse should measure the vital signs in the following sequence. A. Pulse, respirations, temperature. B. Temperature, pulse, respirations. C. Respirations, temperature, pulse. D. Respirations, pulse, temperature. The answer is D, respirations, pulse, temperature. For 11, a nurse is assessing a 2-day-old full-term male neon circumcision. She observed that the circumcised area is a large amount of fresh blood. Heart rate 110/min. Respiratory rate 40/min. Temperature 36.62 C. Which of the following action should the nurse take? A. Apply antibiotic ointment on the affected area. B. Give the infant another injection of vitamin K. C. Clean the area with betadine to prevent infection. D. Apply gentle pressure with a sterile gauze. The answer is D. Apply gentle pressure with a sterile gauze. For 12, a maternity nurse is performing a newborn assessment 30 minutes after delivery of a baby who did not receive any prenatal care and has an unknown gestational age. The skin is extensively leathery, cracked and dry, and there is an absence of lanugo and vernix. How many weeks gestation is this neonate? A. Less than 30. B. 30 to 35. C. 36 to 40. D. Greater than 40. The answer is D. Greater than 40. For 13, a nurse is caring for a female newborn who born with an imperforate anus. When assessing the newborn's urine, she should notify the doctor immediately if the newborn's urine contains which of the following? A. Meconium. B. Sugar. C. Albumin. D. Crystals. The answer is A. Meconium. For 14, a newborn has diagnosed development dysplasia of hip DDH and is using a Pavlik harness as treatment. A. Multiple. B. Acetabular dysplasia. C. Subluxation. D. Dislocation. The answer is D. Dislocation. For 15, which of the following is the most common site to obtain a capillary blood sugar sample from neonate? A. Urolape. B. Fingertip. C. Heel. D. Abdomen. The answer is C. Heel. For 16, a client who is breastfeeding her newborn requests assistance from the lactation nurse. Which reflex does the nurse explain in order to assist with latching on? A. Extrusion reflex. B. Rooting reflex. C. Swallowing reflex. D. Tonic neck reflex. The answer is D. Rooting reflex. For 17, a healthy baby is born normally via vaginal delivery and when transferred to newborn until the nurse administered vitamin K intramuscularly. Which sits recommended for vitamin K injection? A. Biceps. B. Deltoid. C. Vastus lateralis. D. Gluteus maximus. The answer is C. Vastus lateralis. For 18, the nurse determines that a client understands the purpose of a vitamin K injection for her newborn if the client states that VK is administered for which purpose. A. Newborn lack vitamin. B. Newborn have low blood levels. C. Newborn lack intestinal bacteria. D. Newborn cannot produce vitamin K in the liver. The answer is C. Newborn lack intestinal bacteria. For 19, a nurse is administering a shot of vitamin K to 30-day-old infant. Which of the following target area is the most appropriate? A. Gluteus maximus. B. Gluteus minimus. C. Vastus lateralis. D. Vastus medialis. The answer is C. Vastus lateralis. For 20, while a nurse is assessing the head of a newborn at the first hour after delivery, she observed a soft edema over the vertex which crosses the suture line. Which of the following would be the proper nurse's interpretation? A. Cephalohematoma. B. Hydrocephaly. C. Large head. D. Caput succedaneum. The answer is D. Caput succedaneum.